Welcome to the Heart of Innovation, 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Cardiovascular System Incorporated's patient advocacy campaign, Take a Stand Against Amputation. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kym McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
And welcome to the Heart of Innovation, 60 minutes dedicated to saving life and limb. This is our very first episode, and the goal of this show is to bring together doctors, patients, researchers, innovators, decision makers, and so much more to share ideas that will shape the new paradigm in healthcare, specifically when it comes to vascular diseases, which remain the number one killer here in the United States. A big component of the show is about empowering you, the patient, with the information you need to become a true advocate for yourself and your family, as well as to raise your voice to help improve patient care. Now, in today's show, we are going to share with you more of what you can expect from this program each week, as well as to better understand who we are and why we are here with you today, so passionate about saving life and limb. We will also take your calls to join into the conversation. Our call-in number is 1-888-367-5329. That's 1-888-367-5329. And remember, the advice and views offered here during this program are purely for educational use only. Always check with your own healthcare provider before acting on any advice offered here. And without further ado, thank you so much for being a part of our inaugural episode. Dr. John Phillips is here with us, my co-host. John, you're right off a trip to South Africa and just getting your land legs back over here.
Yes, Kym, I am. And man, I'm so excited to be on this show. I appreciate really the opportunity to co-host this with you. We've known each other for a while now, and at the end of the day, you're exactly right. This show is for you, the patient out there. We're passionate about raising awareness, not only for peripheral arterial disease, but cardiovascular disease in general. Did you know that even in your first decade, you start developing signs of blockages in the arteries, and it just continues to progress? And unfortunately, if you're a Westerner, you're most likely either going to die from cardiovascular disease or cancer. And this show is hopefully going to allow the patients and doctors and innovators within the fields to come together and raise awareness and really just have a good time. So I'm super stoked, appreciate the opportunity, and let's have some fun.
Yeah, I'm right off. I'm a little jet lagged. I got in at 1 a.m., but just to give you an example, I mean, we're really on the cutting edge. I just got back from NCVH. Another top interventional cardiologist, Craig Walker, has a fantastic cutting edge conference where they talk about advanced tools and techniques for unblocking arteries. And one of the big conversations was, how do we get this diagnosed sooner when it comes to vascular issues? And you even saying that in the first decade of life, there are signs and symptoms that, wow, what if we knew earlier? Could we make critical changes at that point to prevent heart disease from advancing to a point of heart attack, stroke, and with peripheral artery disease, which is the plaque buildup in the leg arteries mainly, but also in the arms and sometimes the brain as well. How do we get to those sooner and prevent those from progressing early on for people so they can live a longer, healthier life?
You know, Kym, in my opinion, it's all about raising awareness and early education. Unfortunately, I think we've all seen the shift in our Western civilization and to immobility. Kids, and my children are not prime examples, but they spend a fair amount of time on their phones in their rooms, not outside running around being active. And the more sedentary lifestyle you lead, the more kind of inappropriate foods you eat, that all kind of builds up. And
everything has sugar or high fructose corn syrup these days. It's hidden in everything.
Well, and we're seeing kids develop, elevated glucose levels, and pre-diabetics are in the millions in this country. So we just have to be mindful, because like when you talk about vascular disease, we kind of lump peripheral arterial disease. That's mainly blockages in the leg arteries. We talk about coronary disease, so blockages in the heart arteries, and then we talk about cerebral vascular disease. The problem is that about 63% or 65% of patients with peripheral arterial disease also have blockages in those other beds. So we call it kind of polyvascular disease. And those are the people that are really the sickest of the sick. And those are the people that need to listen to shows like this and really get with their healthcare professionals and understand their disease process and do what they can to mitigate their risks.
Right. 3 in 5 people who suffer a heart attack have the plaque buildup in their legs. And it only takes 2 seconds and 2 fingers for every single primary care doctor to just even feel the leg pulses of every patient, especially diabetics over the age of 40, but everyone over the age of 50, to see if they have turbulent flow in their legs, how the pulses are doing, make sure that they're, bounding pulses in the legs, because your legs can indicate the health of your heart as well.
Yeah, I agree. And to some degree, it's a little bit of a lost art, the exam, because everybody's busy and we spend a lot of time in front of our computer on the electronic medical record doing appropriate charting. But to your point, you take an extra minute or two and assess the patient's vascular status with just your fingers, looking for pulses, and then talking to the patient too. The patients are is going to tell you what's wrong with them.
Yeah, they are. They just have to listen. But I know, you as an interventional cardiologist, you probably deal with the very limited times that you have with your patients, 15 minutes sometimes, and half that time needs to be spent taking the notes. And so you don't have as much time to really just touch the patient, to feel for an aneurysm in their abdomen, to feel their foot pulses. And there's so much that patients can do. And I think that that's going to be a big component of this show, is to really empower you, the patient, with the right information to help become a partner in your health, in your own health, and hopefully slow the progression or even prevent the progression of these vascular diseases. Now we have to take a quick break. So don't forget, this is a live call-in show. So write or type this number down and save it. So if you have questions or insight to share, you can join the conversation. Again, it's 1-888-367-5329, 1-888-367-5329. And we will be right back with more The Heart of Innovation. So stay with us.
Keep listening, folks.
Leg health can indicate risk for heart attack, stroke, and amputation. If you have leg pain or cramps while walking, get checked for Peripheral Artery Disease, or P.A.D. P.A.D. is plaque buildup in mainly the leg arteries. Be sure to ask your physician for an ankle brachial index, also called an ABI test, where they use blood pressure cuffs to analyze the blood pressure in your legs. If they discover you have arterial plaque that's limiting blood flow to your feet, medicine and a regimented walking program are frontline treatment. If P.A.D. is in its advanced stages, your physician may schedule a surgical intervention. Minimally invasive tools are available to remove plaque and restore blood flow, including Cardiovascular System's Diamondback 360 atherectomy system, which sands away plaque that is a hard calcium. It's important to discuss all options with your physician, and if told you have no options, get a second opinion. Take a stand against amputation. For more information, go to standagainsamputation.com. That's standagainsamputation.com.
Well, hey everyone, my name is Dr. David Alper, and I'm coming to you today for the Weight of My Heart's Footnotes. And today we're going to talk about shoes. Why are we going to talk about shoes? Well, because just like an engineer or an architect or a carpenter, you're really only as good as your equipment, and the same thing is true with feet. And in order to make sure we keep our feet healthy, we need to make sure that the shoes are not causing problems and are doing the job they need to. The first thing you want to do is you want to make sure your shoes fit properly. Too many people wear shoes that are too small, and it's a very simple way to check. When you're sitting, you grab the end of the shoe with your fingers, and if you can touch your big toe, it's too short. You should be able to reach all the way to the bottom of the shoe without touching the big toe when you're sitting. And that allows the foot to spread out. You also want to put your hand inside the shoe and feel. What are you feeling for? Any rough spots? Anything that might be torn? Because it needs to be smooth in there so it's not an irritant. And while your hand is in there, let's check for spiders. I know it's a little creepy, but the truth is that overnight, little creatures in the night can get in there, and the last thing you want to do is suffer with any type of a bite. You want to make sure that you're able to tie your shoes comfortably. Don't make them too tight. If you have to pull them that tight, they're not fitting properly. And a shoe that's too big can be as problematic as one that's too small because, again, the rubbing. I keep mentioning rubbing, but this is one of the biggest causes of ulcerations, wounds, and infections in a foot, especially with someone with P.A.D. or diabetes. So we want to make sure that the equipment fits well, we want to ensure it's not causing problems, and you're able to walk comfortably. My name is Dr. David Alper. For more information, reach out to the American Podiatric Medical Association at apma.org, the American Diabetes Association at diabetes.org, and of course, the Way to My Heart.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back. Remember, this is a live call-in show, so write this number down and use it, 1-888-367-5329, 888-367-5329. Tell us what you'd like to hear us address. And remember, the advice and views offered here, educational and informational purposes only. Always check with your own healthcare provider who knows you best to get their explicit consent before acting on any information provided here. With that being said, before the break, Dr. Phillips, we were talking just about the purpose of the show and some of the issues and why we're focusing on vascular diseases such as heart disease and peripheral artery disease. Peripheral artery disease is something that we are going to address a lot because most people don't know they have it, and it impacts 1 in, I think, 5 over the age of 60, 1 in 3 diabetics over the age of 40. And when you're talking about, I heard a number that 40% of people in the United States are either pre-diabetic or diabetic. Most of you need to make sure that you are urging your primary care physician to take 2 seconds and 2 fingers to feel your leg pulses, because it could save life and limb. So what makes this show different, Dr. Phillips? What are you excited about in terms of all of what people are going to be able to experience as we move forward every Saturday?
And just to dovetail real quick on what you said about P.A.D., there's 220 million people worldwide that have peripheral arterial disease. Unfortunately, about half that have it, based on some simple testing, don't know they have it. And patients with peripheral arterial disease, they don't die from that blockage in the leg artery. They die from a stroke or a heart attack, and that's why we're here, to answer your other question. You and I connected about 2 years ago when we were brought together in the setting of my desire to just have a podcast for patients. And I call it Save My Piggies. And basically what I wanted to do was interact with patients and hear their story about their peripheral arterial disease. Because a lot of times patients that have peripheral arterial disease, they don't know they have it until it's too late. A little kind of discoloration on the great toe, for example, can be a sign that you have severe peripheral arterial disease. And if you don't know how to recognize that, it can lead to a missing toe, a missing forefoot, and a missing leg. And what I want to do with this show, and I think of myself as a physician, kind of the coach and not the quarterback of that patient's care. And it's all about, in my opinion, empowering the patient. I want them to be the quarterback. We give them a playbook. They've got to execute the plays. I want the patients or those that listen to this show, I want them to be empowered, ask the right questions, and save the piggies, prevent those amputations, which can lead to, significant comorbidities and mortality and increased mortality rates in this patient population. So I'm an interventional cardiologist, basically a plumber. And I got interested in peripheral arterial disease about 10 years ago when I started my practice. And I spend a lot of time opening blocked arteries in patients' legs who have blockages that are causing difficulty when they walk, but also mainly blockages that are leading to ulcers that can lead to limb loss and ultimately death.
Right. So what is it, though, that really made you passionate about P.A.D. and unblocking arteries, particularly in the legs? Because, when you were first starting out in your initial training was in unblocking arteries in the heart.
You're right. Well, it's again, this kind of unmet need. Back at that time, the diagnosis of P.A.D., so 10 years ago or so, was less than what it is right now, just because people weren't really, they didn't really know what it was, so to speak, the patients at least. And the other thing was what got me inspired to connect with you and others like you is the fact that there's no advocacy. Patients, there's no face to peripheral arterial disease. And I always comment that patients, there's faces to cancer, breast cancer. We know a lot of famous people that have had it and survived it. But we don't really have a face for P.A.D. And my goal was to do the Save My Piggies and bring lots of faces to P.A.D. and allow the patient to be that quarterback for their care, learn about their disease process, and ask the right questions. Don't get pigeonholed into one treatment plan or another, but know enough about your disease that you can find the right doctor and healthcare team that's going to allow you to heal that wound, if there is a wound from that blockage, or get the blockage fixed, and ultimately have a more fruitful life.
And I think that's what's going to set this show apart is you can go on to Dr. Google. Your doctor can provide you with a lot of collateral assets. But what this is going to be is a living, breathing, evolving conversation about what's happening in healthcare today and the sharing of real life stories and helping you, the patient, live right here on the air and navigating your healthcare. It's going to be really important. We want you to become a part of the conversation. We are going to be live at conferences, bringing you straight to the cutting edge tools and techniques that are being used that you'll be able to talk to your doctor about, to understand that different doctors have different tools, different techniques. And you need to always get a second opinion because innovation in this space, new techniques, new tools, it's moving at the speed of light. And we are going to do our best to help you to keep up with everything that's happening. We are going to call physicians live while they're in clinic, while they're on their rounds, when they have just taken their gloves off following a procedure. We are going to bring those conversations to you live, and you are going to be a part of it. You are going to be able to share your insights and ask your questions.
We're going to make it real, right, Kim? I mean, this is going to be real. It's like you said, living, breathing. We want interaction with patients and physicians and healthcare providers. We want tough questions. We'll do our best to answer them. And I always say, if I don't know the answer today, we'll get back to you next week and get it. But it's going to be awesome.
Now, coming up after the break, you'll find out why I am so passionate. No, I am not a doctor. No, I am not a clinician. I am an Emmy Award-winning journalist. What inspired me to go from Emmy Award-winning journalist to peripheral artery disease activist? That's coming up next right here on The Heart of Innovation. So stay with us.
Medical Notepad, brought to you by patient advocacy organizations Take a Stand Against Amputation and The Way to My Heart. Here is Dr. Kirk Minkus, vascular and interventional radiologist at Southwest Cardiovascular Associates in Phoenix, Arizona. What is peripheral artery disease, its symptoms and risk factors?
Hi, my name is Dr. Kirk Minkus, and I'm an interventional radiologist and vascular specialist that works in Phoenix, Arizona. I want to talk to you today about something called peripheral arterial disease, which is an affliction that affects the legs and can seriously restrict the amount of arterial blood flow that moves from your heart down to your toes, and mainly in the arterial vessels of your pelvis, your legs, and your feet. People that have this development may have claudication, which is pain while you walk, limitation to how far you can walk, pain and cramping in the calves or the legs, discoloration of the feet and toes, maybe a purple or blue color, numbness in your feet or toes, tingling that you feel in your legs or your feet, and lack of hair on your legs that may be noticeable. As well, the risk factors that are associated with peripheral arterial disease are people that are 50 years or older, people that have diabetes, hypertension or high blood pressure, hyperlipidemia or high cholesterol, or anyone that's had a stroke or heart attack, or anyone that possibly has had renal insufficiency or kidney failure. Also, anyone that currently smokes or previously did smoke can be at risk for peripheral arterial disease. If you have any of these symptoms or risk factors that are,
Go to thewaytomyheart.org.
you really should get in touch with a vascular specialist like myself so we can discuss with you all the treatments we have to help resolve these symptoms for you.
With Medical Notepad, that was Dr. Kirk Minkus, vascular and interventional radiologist at Southwest Cardiovascular Associates in Phoenix, Arizona. The Medical Notepad series is for educational and informational purposes only. Advice offered is not a substitute for medical advice from your own supervising physician. Do not act on any information provided in this series without the explicit consent from your own healthcare team. For more information, go to standagainsamputation.com.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Hello, everybody. Welcome back. We are already in the second half hour of the show. We're having a blast. This is a live call-in show. The number is 888-367-5329. So please call us with any questions, comments, clarifications. So, Kym, at that last segment, we were just kind of touching base about, you were asking me why I got into peripheral arterial disease and critical limb ischemia and how we kind of connected. I'd like you to share with the audience why you're so passionate about peripheral arterial disease and how you went from a journalist to, finance and energy to pivoting to the medical space. Before I kick it to you, I just want to say that when you and I connected 2 plus years ago about the Save My Piggies podcast, it was amazing to me how passionate you were about peripheral arterial disease. And I was curious. I'm like, why does this individual love P.A.D., or is so passionate about P.A.D. and raising awareness and really getting patients, involved? And the more I learned about what your mission was, the more I was really impressed, and just so happy that we're able to finally get a show off the ground. So, Kym, take it away. Tell us about yourself.
It's all about bringing this information now to the mainstream. I just think that we're on the cusp where there are so many amazing organizations now that are all raising awareness for PAD or peripheral artery disease. And, as you said, I'm an Emmy Award-winning journalist, and I have always been known to immerse myself in, stories. And I ended up with an opportunity to put my journalism on hold for a moment and run a global startup competition with Sir Richard Branson, the Virgin Brands, Sir Richard Branson as our anchor judge. And I thought, God, I've never done anything like that before. Why? I don't know. I'm a great writer, great journalist, but I don't know about that. And I remember he said this distinctly: don't let what you don't know and have never done before get in the way of doing something great. Sometimes it's what you don't know that could end up being your greatest asset in creating disruption in any industry. So just say yes, trust yourself, trust your experience and what you can bring to the table, and just get it done. Just do it. And so I ended up helping to turn that startup competition, the Extreme Tech Challenge, into the world's largest startup competition of its time. And it's gotten even bigger ever since. And it was during that experience that I ended up discovering that healthcare innovation was moving at the speed of light. There were a lot of startups in this space and so many great things happening. And I got the opportunity to launch a radio show, Kym McNicholas on Innovation, back in 2015, I think it was. And I was able to bring a lot of these new healthcare companies to the forefront. And it was during that time I ended up learning about a new device that doctors had told me they thought would change the game in cardiovascular disease. But the first leg of the journey in bringing this device to market was starting with the legs, the first leg of the journey. You get that. Was starting with the legs, and they needed to unblock arteries in the legs first, prove the concept there, and then go and start trying to unblock arteries in the heart. I ended up traveling to nearly a dozen countries, more than 30 states, watching hundreds of doctors perform thousands of hours of procedures in which they used all kinds of different techniques to treat both peripheral artery disease and heart disease, but mainly at the time it was peripheral artery disease. I watched bypasses, I watched amputations, which you can't unsee an upside down leg in the garbage can. And that literally changed my life and my whole perspective. I had to start bringing this information to the patients and seeing in one hospital that a leg is being saved. And then in another hospital, even 1 hour away, a doctor is using a more advanced tool and technique and saving a leg. And so I just started informally bringing that information to patients online. And it wasn't until my dad ended up on the verge of a heart attack. He started having indigestion, is the way he described it. And we went to the doctor, and the doctor said, here's some Prilosec, have a nice day. And I said, my dad has a history of heart disease in his family. Is it possible that he has a blockage in his heart? And they said, no, he's complaining about burping and indigestion and this and that. I said, I want to push for an ECG. And so at first she resisted, but then I said, here's my credit card. Don't worry about Medicare. I'll pay cash. And she did the test. Was that an issue?
That wasn't.
Oh, it was a huge issue. She said, I don't have a diagnosis code to input in there because his symptoms to me indicate that it's actually indigestion and needs Prilosec. And I said, I don't think sometimes the patient knows. And sometimes the patient can steer the doctor in the wrong direction. And that's where you have to kind of stop for a second. And lo and behold, the ECG showed an abnormality.
But Kym, that's why we're here, right? Like
exactly.
The patient doesn't know. And our job is because not every dad has a Kym, right? And so this is exactly why we're here. So the patient knows and they can be the quarterback.
Exactly. You can't, you can't sit there and as the patient and steer the doctor. You need to just sometimes be very candid about your symptoms, but also know the right questions. And we're here to help you with the right questions to ask in order to catch, because early diagnosis equals early treatment equals a better quality of and longer life. And it was at that point in that experience and traveling the world and seeing how doctors were unblocking arteries that I was able to say to these doctors, now, wait a minute, you're not just going to throw him on the table now and do whatever you will using whatever tools and techniques you have at your fingertips. I want to know exactly where are these blockages? What tools are you using? And the doctor said, oh, no, don't worry about that. We're going to do whatever we do anyway. We have the best doctors. And I said, no, I want a CT scan. He said, no, not very good imaging. I said, doc, what about a 256 slice CT scan? And the doctor said, oh, yeah, we just got one of those. 3D modeling of the heart. Yeah, that's a really good idea. So we were able to, after that, sit down with the interventional cardiologist and talk him down from placing 5 stents to 1 stent and seeing how they went going forward and how my dad's lifestyle modifications in the next year would impact or slow the progression of disease. And I decided to start the waytomyheart.org. And we provide education, high-touch advocacy. I support people during their appointments. I show up like I do with my dad, and we have our team of wellness experts that do the same. And we follow up with each patient afterwards to help strategize on their lifestyle modifications to ensure that they don't fall through the cracks and that they are ending up with a better quality of life. And we'll continue my story coming up in just a moment. We have to hit another break, another educational segment. So stay with us.
We have to pay for the show.
Exactly. Stay with us.
My symptoms started with leg pain and leg cramps while walking.
Me too, with a tightness in my calves.
Well, do you know, my doctor thought that my leg cramps were a side effect of the statin he prescribed me.
Well, my doctor just brushed them off as another symptom of old age.
Mine thought the pain was radiating from my spine.
My doctor blamed my neuropathy on diabetes until I got a wound on my foot that just wouldn't heal.
Yeah, it turns out we all have peripheral artery disease, also known as P.A.D.
It's plaque buildup mainly in the leg arteries causing poor circulation.
For me, the diagnosis came too late and I lost my leg, but that does not have to happen to you.
No, it does not, because there are treatment options available if you're diagnosed early enough.
P.A.D. Peripheral Artery Disease. If you've been experiencing leg pain, leg cramps, or neuropathy when walking, and your doctor isn't hearing you, we are. We are The Way to My Heart, the largest support network for peripheral artery disease patients, and we want to help you get back on your feet again. Visit our website at thewaytomyheart.org or call our Lifesaver hotline 415-320-7138. Your life and limb could depend on it.
Leg health can indicate risk for heart attack, stroke, and amputation. If you have leg pain or cramps while walking, get checked for peripheral artery disease, or P.A.D. P.A.D. is plaque buildup in mainly the leg arteries. Be sure to ask your physician for an ankle brachial index, also called an ABI test, where they use blood pressure cuffs to analyze the blood pressure in your legs. If they discover you have arterial plaque that's limiting blood flow to your feet, medicine and a regimented walking program are frontline treatment. If P.A.D. is in its advanced stages, your physician may schedule a surgical intervention. Minimally invasive tools are available to remove plaque and restore blood flow, including Cardiovascular System's Diamondback 360 atherectomy system, which sands away plaque that is a hard calcium. It's important to discuss all options with your physician, and if told you have no options, get a second opinion. Take a stand against amputation. For more information, go to standagainstamputation.com. That's standagainstamputation.com.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Well, welcome back, everybody. Thanks for hanging with us. Again, this is a live call-in show. If you have any questions, comments, etc., call us at 888-367-5329. Kym, before that last segment break, you were kind of just sharing us about the way to your heart and how really a big part of what you want to accomplish is patient advocacy, not only with if they need a procedure, but also before that, lifestyle modifications, things like that. Can you go into that a little bit further?
Yeah, it started out really with being able to say what I did for my dad in the high touch advocacy based on the knowledge that I gained through thousands of hours inside these procedures, watching these doctors perform successful operations with using minimally invasive tools, especially. I wanted to provide that at scale to everyone and to provide them with the critical questions to ask their doctor. But then as part of that, I was in a procedure with a doctor, and he was doing amazing work with some of the most complex lesions at a large hospital in the South. And I said, I really want to interview you. He said, let's go to my clinic first before I can do this interview. I have a couple more patients just to talk to, and you can join me there. And it was his last patient of the day, an African-American man that was actually 50 years old. You would have thought he was in his 80s. And he said, I have some bad news for you. We've already tried to unblock your arteries in your legs, and you're just going to have to keep coming back. So let's just delay the inevitable and perform an amputation. And the man burst in tears, a grown man crying, and said, okay, doc, yes, sir, whatever you say, sir. And he left. And it just broke me. I said, hey, doc, what the heck? Because I'm not allowed to say anything in front of the patient.
Right.
And I said, I don't understand. I saw you do more complex cases earlier. And he said, this is a Black man from the projects. He's not going to take care of himself, not stop smoking, not eat right, doesn't walk. And I said, gosh, doc, do you support him? Does he have a support system? I said, that is really discouraging. And that's when I started learning about the real disparities in healthcare. And it's a real, whether or not you get an amputation or your leg is saved, a lot of times depends on the zip code that you're in. And it's very tragic. And so I really made it a big component of what the Way to My Heart does, is reaching out to these communities, providing the healthy food, providing transportation to and from appointments, helping them with their smoking cessation. It's really an important component. It's that support network, not just saying, go do this, but it's saying, hey, we're going to hold your hand along the way. We know it's hard. And actually, we have a patient on the line right now, Douglas, who has been working with the Way to My Heart. And he not only started walking because of us, but he actually is now leading our walking community. Douglas, hello. Thanks for calling in.
I'm here.
Great. So do you have a question for us, for Dr. Phillips?
Yes, sir, I do. So I've also learned a lot since I've been a part of this group, and it is going to be between the patients and the doctors. But how do we get, as patients, how do we get our doctors to become more aware of, like, all the techniques that are out there? Because I've had 2 bypasses now, and I never heard the word kissing stents. I never heard any of the other stuff. He went straight to the bypasses. And it's like, as patient, I have to be responsible for that. But like y'all been talking about, I didn't know any of this stuff till I got in this group. So it's going to take a whole team, isn't it?
Yeah, Douglas, thanks for calling in. Just my opinion on that. Patients often can be treated with balloons and stents, but sometimes they need bypass. That's why it's just important to have a physician or group of physicians that you trust and that are knowledgeable with respect to the disease process, and kind of tailor a personalized treatment plan for you. So I'm an interventional cardiologist. I don't do surgery, but I work with vascular surgeons, and if there are cases where I don't feel like I can treat them appropriately with the equipment that I have, I refer them for bypass. But it's groups like what Kym is doing, Way to My Heart. It's shows like this, in my opinion, that allow patients to learn more about the disease process, what's out there, ask the right questions, and really be, like I said, be that quarterback of their care. Get a good coach, but you've got to execute those plays.
And I also think it's really important, for example, the conference that I attended, NCVH, just in the past couple of days, that the doctors were saying, wow, it's really great what we're learning here, but we're almost all ones who are attending this conference that are already drinking the Kool-Aid. How do we inspire other doctors who may be in different areas to come and join and want to learn something new and something different, or even know that there is something different available? And we do have actually a doctor who was at the conference, and we're going to get to him in just a moment, but stay with us here at the Heart of Innovation.
Plaque removal is a lifelong journey. Hi, I'm Brenda, and that's my lesson to share in this P.A.D. Warriors Tell All. I am 64 years old and have peripheral artery disease, or P.A.D., which is poor circulation in mainly the legs. I also have type 2 diabetes, which is one of the factors that can lead to slow flow in the leg arteries. My experience with P.A.D., or P.A.D., started in the summer of 2010. I was speed walking with a friend when suddenly I couldn't walk. My legs felt like concrete. I had pain in my calves. I had to stop and rest. When I told my primary care doctor about my symptoms, I was sent to a vascular specialist for assessment. He did an ultrasound and discovered I had some plaque buildup in my arteries that was restricting the blood flow. So he scheduled me for an advanced diagnostic and treatment procedure on my right leg called an angiogram. That's where the doctor pumps contrast fluid into your arteries so he can see what's happening inside them under X-ray. During that procedure, he removed some of the plaque using a special device, then pumped up a balloon to push the rest of the plaque to the sides. all in hopes of increasing the blood flow to my legs. He placed a stent afterwards, which is a metal scaffolding to keep the artery open in the area that he treated. He did the same procedure to my left leg 1 month later. I was doing great for a while, 6 months to be exact, but then I started feeling the cramping in my right leg again. The vascular specialist said the stents he'd placed had blocked. So he had to go in and clean them out. The next month, the same happened with the stents in my left leg. He cleaned those out too. The revolving door of treatment to clean out the stents continued every 6 months to a year for 10 years. At that point, my vascular specialist said the stents could not be cleaned out anymore, and that my only chance of keeping my legs attached was to have an invasive bypass operation on each leg. A bypass is where they make 1 or 2 incisions the length of my leg to place a graft designed to reroute the blood flow around my blocked stents. The catch was, if that failed, they said there was no other option but amputation. I was horrified at the thought of losing my legs, so I contacted a patient advocacy organization called The Way to My Heart. They got me to another vascular specialist for a second opinion. I didn't know up till that point that different doctors with the same vascular title had different tools and techniques. This doctor was trained in more advanced, lower trauma-causing methods of cleaning out the arteries than my other vascular doctor. So he went in and took a stab at cleaning out my vessels. He was successful in both legs. But it was from him that I learned that stents aren't always necessary, that newer methods of treatment for P.A.D are designed to reduce the need for stents. Once you have them, though, regular cleanings are necessary. Just like when you go to the dentist once or twice a year to get plaque cleaned off your teeth. Same goes for the arteries in some cases, especially mine, because of the stents. Why? Because sometimes stents in the legs can trigger a healing response in the body, creating scar tissue. That can end up blocking the blood flow again. If I would have known this sooner, I would have found a more advanced doctor who is more discriminate with the use of stents, like the one I have now. Some say there's only so many times stents can be cleaned out. Not my new vascular specialist. He says the key is recognizing the symptoms, that a narrowing may be occurring sooner, especially leg pain and cramping that limits my walking distance. At the onset, I'm to call for a checkup immediately, and if there is a blockage, he'll kiss it with a balloon to get me back in the flow. I'm so lucky to have sought a second opinion through The Way to My Heart and found an advanced skill vascular specialist. He sees us as partners for life, and he's committed to help me continue to stand on 2 feet. If I could do it all over again, I would have contacted The Way to My Heart sooner to find out all my options and learn how to select the most advanced vascular specialist before any procedure. But I can't go back, and I'm okay with that because I know that just like my teeth, my arteries are now just part of my body maintenance routine as I continue to pursue a better quality of life while living with P.A.D. I'm Brenda, and this is a P.A.D Warrior Tell-All.
Patients Tell-All is a series of real patients sharing their individual experiences. Individual results may vary. Patient testimonials are not claimed to represent typical results or guarantee that anyone will achieve the same or similar results. This series is for educational purposes only, and any advice offered is not a substitute for medical advice from your own supervising physician. Do not act on any information provided in this series without explicit consent from your own healthcare team. For more information on vascular diseases, go to www.standagainsamputation.com, and for real-time support, go to www.thewaytofmyheart.org.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kym McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the program. Wow, an hour goes really, really quickly as we're just finding out here at the Heart of Innovation. And Dr. Phillips and I are just in here laughing, going, wait, where did the hour just go? As we've talked about, this is a live call-in show. Participation is really key, and involving the patients, researchers, innovators, decision makers, and even more doctors into the conversation. Speaking of doctors, we have Dr. Faddy Saab out of Michigan. He is one of the most advanced interventional cardiologists in the world. And we both just got back from the NCVH conference where we learned so many new tools and techniques. And Dr. Saab, are you jet lagged?
Hi, Kym. Hi, John. Thanks for reaching out, Kym, and letting me know that Dr. Phillips is on today so I can call and heckle him a little bit.
I love it. I love it.
So, John is one of CLI fighters. He's a colleague, but a pioneer in his area. And I think, Kym, you and John touched on this. Unfortunately, there isn't that many vascular specialists that are knowledgeable within the field of limb amputation per se. And there's a lot of good doctors out there, but as you pointed out, there's severe deficiencies within the amount of knowledge or what can be done to salvage patients. But if I may, I wanted to just reiterate something that John said and you said earlier, and me as a physician actually appealing to all the patients and patient advocates and patient family members that we need their help. We need their help because, just as Dr. Phillips and myself advocate for these patients that have no options or told that they have no options where we felt that they actually do, in the same way, I think it's very helpful if these physicians let doctors like me and Dr. Phillips and the primary care physician write letters to their physicians, write letters to the policymakers within their state where they live. Because I got to tell you, it's a constant battle with this deadly disease. But what's frustrating and painful is when you're having battle with insurance companies that are not necessarily up to date on some of these technologies, when you're having battles with some of your colleagues that not necessarily as advanced or well-versed in these techniques, and that in some instances, not to generalize, but in some instances, something would be considered straightforward to physicians like Dr. Phillips that can be achieved in 2 hours or 3 hours versus, there's nothing we can do and the patient will lose their leg. So
very, very wise.
That's kind of an important area that I think we physicians, especially the physicians that do this kind of work, need your help.
And that's where we are. Thank you so much, Dr. Saab. This is the Heart of Innovation. We'll see you next week.
Thanks, everybody.
Take care.
60 Minutes that could save life and limb. The Heart of Innovation, hosted by Emmy Award-winning journalist and patient navigator Kym McNicholas and interventional cardiologist Dr. John Phillips. Discover new game-changing ideas and innovation shaping the new frontier of healthcare. Join the discussion with physicians, clinicians, policymakers, and most importantly, patients. Ask physicians your burning questions and get real-time guidance and support. The Heart of Innovation, heard each Saturday at 11 a.m. right here on 860 a.m. The Answer.